In the fight against this coronavirus, these are our frontline warriors. But they say they're running out of what they need to keep us and themselves safe. In Petaluma, California, Battalion Chief Chad Costa's team of firefighter, paramedics, and EMTs respond to more than a dozen medical calls every day, each one a risk of coronavirus exposure.
All right, so our engine company just got back from a medical call.
They've made changes to their protocols. They ask 911 callers to meet them outside if possible. They take off their shoes when they return to the station, and they clean everything.
Ensuring that everything's wiped down and clean prior to rolling on the next incident.
But Costa is already low on essential equipment.
Huge problem for us is just the concern about running out of stuff, and it's very real. We just got notified yesterday that we can't order any more gloves right now, for instance.
At Highland Hospital in Oakland, California, nurses are literally begging for protective equipment.
If we don't have masks, if we don't have gowns, if we don't have sanitizing wipes, you guys, I mean, I literally lost my mind. I came to work the other day, there was no sanitizer at all. How can you do what you're supposed to do if you don't have that? You can't.
Rochelle Pardew Okimoto, who just finished her shift as a newborn ICU nurse at Alta Bates Summit Hospital, says equipment is being reused that simply shouldn't be.
Just today I found out that we're being asked to reuse our gowns. People are being asked to use a mask in various departments and keep those masks all day long. They're having to bargain to get masks to take care of these patients.
When you say bargain, what does that look like?
Pleading with the people that are in charge.
The chief medical officer says with careful reuse, they'll make it, but they need more.
The ability of the government to help encourage and support the production of more masks, more gowns, gloves would be extremely important.
Health and safety experts warn it's not safe to wear them more than once. Costa says he has no choice because he has to save them for when things get worse.
Nobody knows what next week's going to be like. Nobody knows what tomorrow's going to be like.
A weakened health system will cost lives, says Howard Catton, CEO of the International Council of Nurses.
I am really very concerned that we're not doing enough to prioritise and protect nurses and indeed all health workers. In the last few days, we heard from Italy that the rate of infections amongst health workers was at 9%. That's too high, it's worryingly high, but literally in the last 48 hours, we've had reports from Spain that it's 12 to 14%.
When you hear people talking about the need to reopen the economy, do you feel they understand the loss of life that we will be paying to do that among healthcare workers?
If we don't beat this virus, we'll have no economy, we'll have no communities. We will have lost loved ones and health workers as well.
First responders are now making these sorts of impossible choices every day.
When I go home, am I potentially exposing my family? Yes. What's the alternative to that? I mean, I can't tell my wife and my kids, hey, I'm not coming home for 4 months. I'm not willing to do that, and I don't want to do that to them. So what I do is I understand the risk. I mitigate it as much as I can, and quite frankly, it's part of what we do.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.